All right, welcome. It is Nazi from the Pulse of New Hampshire. Welcome to Well Adjusted with Dr. Sam Ayan from Infinite Health Family Chiropractic. I always feel a little bit better once I talk to this man and I see his smiling face. It's soothing. It's soothing. How are you, Dr. Sam Ayan?
I'm near perfect. I love what I do, you know that, and I love speaking to the public and the community, and getting engaged with our chiropractic community. And here I am in the heart of Concord at 126 Loudon Road, and I'm speaking to not just you but the masses.
Yeah, you are. And I want to let you know, too, how important chiropractic is to my life. I mean, I've been adjusted for years by Dr. Sam, but more importantly, Dr. Sam has adjusted my now 11-year-old son. Can you believe it? 11-year-old son since birth, since he was a little pisha.
Yeah, a little pisha.
He was a little pisha. So you know this.
Yes, I do.
We can talk Yiddish to each other.
Yeah.
And it's something that my family believes in, and it really has made a big difference. And we have two wonderful guests joining us today, don't we, Dr. Sam?
Yeah, we do. We have. So I was at a seminar this weekend with these lovely ladies. Dr. Trea, I actually call her my chiropractor when I'm at the seminars because I just love her adjustments. But they are women that are powerful in chiropractic. Dr. Melinda Hallam, they're both from Tennessee, is a second-generation chiropractor, and she is a little involved in the state association in Tennessee. And then I know that Dr. Trea Wessel also same thing. She's involved, but she's been serving her community for about 17 years. And Dr. Hallam is a 5-year-old veteran, a five-year veteran, and absolutely phenomenal, powerful women that I just love to have on the show and talk to people.
All right, let's bring them in. Welcome, ladies. Welcome to the show.
Thank you. So thank you so much, first off, for doing this on sort of short notice. I really appreciate it. And I just wanted to get your, so Dr. Hallam, I was just wondering, we were talking a little bit about it. What's your feel of what's going on with chiropractic in your state? And you had mentioned something about people getting engaged with their senators, or how they can get engaged, and what it's about.
Yeah, so our state has a very active lobby. We're very proud of our chiropractic association, and they are constantly involved trying to make chiropractic the best that it can be in our state. State-wise, we just got approval to add adults to TennCare coverage. That will start in January. So we're excited about that. Previously, they've only covered children. Wow. So understanding that people are recognizing the importance of chiropractic care for adults as well as children, and that it's a cost-effective measure for our state. So we're really excited about that. And the thing that I wanted to push for people nationally to get involved with is that the federal funding for Medicare, there is a big push right now for chiropractors to be able to be paid for anything that they are licensed to do. So currently, if you go to a chiropractor and have a new patient exam, even though that's necessary, Medicare is not going to pay for it. Oh. And this big push that I'm trying to get everybody to get involved, email your senators, say, yes, please support this, is for chiropractors to be paid by Medicare for any service that they are able to do.
Yeah, so like fair and equal pay for those types of things, and the support of our patients, the support of the culture of people that like chiropractic. They can help support us by getting in touch with their senators and talking to them about that particular aspect.
Now, Dr. Trea, she's nodding her head too. Is there something you wanted to add to that?
I just love that the entire, conversation, like I said, the call to action of people in general, just letting people know that they may seem like it's a small voice, or what can I do? And especially those like yourself, Nazi, that understand chiropractic and know that it's important to your family. You probably have some elderly in your family that, whether they go or not, and if they do, that these services aren't being covered for them. And yet Dr. Sam is, licensed in doing these things, and quite possibly in some form or fashion, maybe even better qualified in certain things. And it just helps that we're going to do these things anyway, and we're required to do them. You're required to do these exams and do these x-rays, even though they won't pay for them. If Medicare finds out that you didn't do those things, even though they don't pay for it, they get pretty upset.
My grandmother did go to a chiropractor. She's since passed on. She did go to a chiropractor, and I remember when I was younger, she had to get a separate insurance that paid for the chiropractic visits, and then there were a few other things. She had really bad hips, and the chiropractor that she was seeing in Boston was the only reason that she could still walk around without a cane up until the age of 90, and she swore by it. And that's when I started going too. If my 90-year-old grandmother is going, she must know something. But I remember she had a special insurance because I think she was on Medicare. I can never remember.
Probably
Medicare.
Yeah, probably.
It didn't cover it. It didn't cover it, and I thought that was weird.
And then secondarily, they can have a secondary policy that will cover the portion that Medicare doesn't. And that's the real difficult thing as well, because older people really get very confused about understanding insurance anyway. They're like, no, I never have to pay anything. We're like, yeah. So a secondary policy will pick up what Medicare doesn't, but they consider this a non-covered service. And that's what Dr. Hallam is talking about, that this is to have that equalized as far as, yes, why would we be taught these things at school? Why would we be licensed and be in our scope of practice if we weren't to do them? So we absolutely should be paid for the work that we're doing.
Yeah.
And we're all going to be there one day. We're all going to be that age. So.
That's correct. And that leads me right into, it's a perfect headway into what I was going to ask about. You're a second-generation chiropractor. And I am sure there have been patients that have been with your dad and now with you because you and changed some things, bringing those people that are still there and have been there for, I don't know, 30, 40, 50 years. Why do you think that is? I mean, why do you think it's important for the Medicare to pay for those things so that they can continue getting those coverages? Yes?
Absolutely.
And so what are your thoughts on that? Why do you think that is, one? And two, the second thing that we have to talk about is, why do you think it's important that people continually stay under care or are at least taking care of their spine for the rest of their lives?
So our office has been in practice for 45 years, and we absolutely have patients who have been here for 45 years. Wow. And it's a blessing and an honor to take care of them. And yes, 45 years ago, they were not on Medicare. But they are now, and they still come in, and they come in for maintenance care because they know that their well-adjusted spine is contributing to their quality of life. Absolutely. So I had a patient just the other day who was saying to me, when I hit 50, my goal was to hit 60. When I hit 60, my goal was to hit 70. And on and on. So when he turned 80, he said, you know what my goal is now? I said, what? He said, to hit 100, and you're part of that. And you're going to get me there. So absolutely, the quality of life that our patients experience being under care from birth all the way through is a huge, huge factor of why people continue to get checked.
Yeah. And, we were just at a seminar this weekend where we were learning how to take care of people better, how to address their questions and to be there and connect with them. And I believe that the connectedness that we have with our patients helps them to understand where we're at. And regardless of whether it be Dr. Hallam or Dr. Trea, Dr. Trea has an associate doctor in her office, whoever the doctor is that's adjusting. Why is it important? And I know that, Dr. Trea, for you, there's an important training tool that we use because you're one of the people that helps train us in at TLC, with TLC, about how the responsibility really lies on the individual to choose how to take care of their health. And I just want to ask you if you could speak a little bit about that. Yeah.
So I think, part of, like you said, the one thing I thought of when we first started this is, as we're going to asking the general public that's listening to this in a call to action about things that they can do and how it's important that and knowing of us is because of this great community of chiropractors that have come together and that we're doing that in order to further our abilities to make better ways that we can discuss things with our patients. So it's important that the patients know what our goals are. And it's important for us to know what the patient's goals are. So what are you coming here for? What do you want in return? And is that something that we can do? And how long is that going to take? So we want to make sure we answer all of those questions. So I think it's extremely important that, the training that we go through to do that, to give our patients the answers they're looking for, and to answer their questions before they're asked, usually. And then Dr. Melinda was expressing, that's why people stay, because you've explained to them what it is that's necessary, what it is that's wrong, and what it's going to take to fix it. And like you said, we learned some things this weekend with some great research that's been done, and a chiropractic, a colleague of ours that loves to delve into that, which I love knowing it. I do not love reading it. So I love that he does that and it shares it with us.
Yeah.
So just another way to give out that great information and make sure that people understand and make that best decision for them. They have to understand that it's their choice, and lifetime care is not a choice. You're going to have your body for the rest of your life, but your quality of that absolutely is. And we help them to see how that plays a role in that, and what part does chiropractic play in that for them.
Right. And that's a big thing. And you were talking about Dr. Len Siskin. I'm hoping to get him on one of these well-adjusted shows, because the gentleman is a I couldn't even tell you, he's just like got so much information and such an intelligent guy. And one of the things does, he makes it so that we can speak to our patients about the importance. Like they were talking about the recent study. They were talking about the recent study about curvature in the neck and the importance of having a normal spinal lordosis in the neck, or cervical curvature, and how it helps with thought processes and health and things of that nature, and looking at those studies. And the general public doesn't know that. However, what we do is we connect them to that information through the things that we do. And like Nazi, like you said, I've had patients since I've opened my office up here that are still patients. Yeah. And the importance of their quality of life, but also something we talk about is the question of truth, which is what is it that an individual can't possibly do anymore, or doesn't even think about. They're like, well, I just can't do that anymore, and because I'm in so much pain. And how is it that we can help them to recognize that, you know what, you don't have to live your life like that, but also to have that goal of say, hey, I just want to be able to sit on the floor with my grandmother, saying, I want to sit on the floor with my grandchildren and play. I mean, have either of you ever had an experience or a story of something like that that's happened, and that those people are like, this is why I bring everybody else?
Dr. Trea, you want to go first?
Sure, absolutely. The first one that comes to mind is her first name's Kathy, and she is an amazing woman and has 8 children. And at the time that she came into me, was not able to sit at the dinner table and eat with her children. She was not able to kneel and give them baths. She was not able to kiss them, bend over and kiss them goodnight in their beds. Pretty life-threatening to a mother of 8. So coming in for that, is then her entire family's under care. She tells everybody all the time. It's just one of those experiences that honest, it was a gift of life. Is that we talk about that a lot of times, that a missed opportunity is not just a missed opportunity. It's a missed opportunity to save someone's life. And that's why we encourage our patients so much to discuss chiropractic, not just the weather, how, and how are things going, but who's your chiropractor, and understanding that it's more than just pain. It's more than just drug-free pain relief, but the quality of life. And so hers was drastically changed, and for obviously for the better. And that was a huge thing, because when you change someone's life in that manner, they never forget that. Nope. And they're going to tell everyone.
Yep. Yeah. So very true. Dr. Melinda, go ahead.
I love that you brought up that it is drug-free pain, because September is Drug-Free Pain Awareness Month. So sorry, I'm going back onto my my political soapbox here, but the opioids, are such a huge issue. We had a conversation with somebody the other day, and she didn't realize that it only takes 3 days to become addicted. And when she had a surgery. And yes, sometimes there's limitation to matter. We say sometimes people have to go these routes, but she didn't know, and her prescription was for 7 days. And even that education, her life could potentially be completely different. We know way too many people in our area where opioids are just rampant. And we have to start educating people that there's a better way, or there's a different way, and that people can have hope, and that they can get back to their quality of life, whether that be playing with their grandkids or doing activities, enjoying their running. You know, marathon runners, people who want to be physically active. That was one who I was thinking of when you first asked this question. You know, somebody who really wants to get out there and run because they love it and they enjoy it, and they just couldn't do it anymore. And so he's back out running and doing great. And it's not, you know, the major things that he comes in for every single day, or not every day, but when he comes in each week, it's the little fine tuning that makes a difference in his 13 miles that he's currently at.
Right.
Wow. Wow.
And that's, you know, that's the big portion of everything that we do. You know, the short story, not only is it, you know, prolonging life and helping people, and there are studies that show those types of things, but it's prolong the quality of life. And, you know, I can recall a gentleman that, God bless him, he passed away many years ago, but he was 90 at the time, and he was getting chiropractic care since he was like in 1940s. And he comes up to me a couple of weeks in, you know, he found out he had cancer, but he comes to me, and I didn't know at the time. And he goes, "I just want to thank you." And I'm like, "For what?" He goes, "You've made my life and my family's life." And I was taking care of 4 generations, him, his daughters, his grandchildren, his great-grandchildren. And I just wanted to say thank you for making my life a better place to be with the adjustments. And honestly, yeah, you know, I was crying when he told me that, because that's how much he valued it. And that's how much we value these things that are going on. So having said that, Dr. Melinda, if you could just tell us where you're located, how people can contact you, and then Dr. Trea, I'll ask you, and then I'll finish up.
I am in Sevierville, Tennessee, 826 Middle Creek Road, and we are on the web at ratcliffechiro.com.
Awesome. And is that the best way to contact you?
Yes.
Okay. And how about you, Dr. Trea?
So I'm in Woodbury, Tennessee. That's about an hour southeast of Nashville. And I run a Cannon County Chiropractic. So it's on my little name tag. And our address is 824 McMinnville Highway, Woodbury, Tennessee. And our website is cannoncountychiro.com. Reach out to us, check us out.
Now I have a quick question.
But you guys are really
either one of you two, did you two know each other before this? Did either one of you know each other before this?
Yes.
You did. How far are you from each other in Tennessee?
3.5 hours. Yeah. So her dad was president of the TCA at one time, and I knew him when I first started. The Tennessee Chiropractors Association allowed young doctors to be a what were they called? Assistant to the director in that area. So I was sat on the board for the Tennessee Chiropractor Association, and her dad remained on the board even after he was no longer president. So I knew him for several years before I got to meet her, and then she did her internship in my office before she graduated chiropractic school.
Very cool. Very cool. So there's a connection. All right, Dr. Sam, you have the final 45 seconds. Take it away, sir.
So I want to thank everybody. Remember, this is a community. We need to help each other. Get out there, get to your senators, come talk to me. Make sure you let people know the importance of chiropractic care and how important it is in people's lives and the hope it brings. Because we need to recognize in others the things that will help us to engage and embrace them. And I am located here. If you want to engage, embrace our office, it's at 126 Loudon Road. The best way to contact us is infinitehealth.biz, or call the office at 603-753-4455. Nazi, I want to thank you for everything you do, and thank you for having us.
You got it. We'll see you next time for Well Adjusted on the Pulse of New Hampshire.
Thank you.